Our last meeting before the final. I won't say much on Wednesday. You'll just pretty much show up, I'll hand you the exam, and I'll let you go to work. So I'd like to say to the class, I hope you got one of three things from this class this semester. Either you learned enough that it helps you advance your career, and that would be great, or you learned something that sends you in a different direction, maybe opens new doors for you. And if neither of those happened, well, maybe you learned enough to keep your family and your home a little safer and a little cleaner for children coming your way. Yes, absolutely. Just in time. So tonight, I figured we would just kind of start out talking about the different systems that we went over and the diseases of those systems, kind of informal here. I'll address any questions if you have. And then if you wanted to go back and talk about some of the other material that was covered throughout the semester, I'll do that as well. Recognize that the test is 100 points. There's going to be 100 questions, 200 points. There'll be 50 or so questions on new material and 50 or so questions on old material. That old material is going to come from your previous exams. The questions might be worded slightly differently, but if you study the previous exams, you should do fine on the older material. With regards to the different systems, the respiratory system, the skin system, the digestive system, recognize that each one of them has different properties about them that allow for certain microbes to grow. Okay, so when we think about the respiratory system, we're going to think about a warm, humid environment. When you think about the skin, we're going to think about something that's dry and arid, high saline concentration. These will kind of help you with identifying microbes that might grow in those environments. Of course, the digestive system then is going to be one that's probably inhospitable to a lot of microbes simply because of the environments in the stomach and the small intestine. That changes, of course, when we get to the large intestine, where you have a environment now that's great for bacterial growth. High nutrient content. Recognize that a lot of the microbes growing in the intestines are going to be anaerobes or facultative anaerobes. It's an environment there where there's probably little oxygen. A couple of other things that we could say about the different environments. Now these are just generalities, but when we consider the skin, a lot of the microbes that you're going to find on the skin are going to be cocci in nature. Micrococci and staphylococcus we find on the skin. In the mouth again, microbes that are cocci, streptococcus, and sometimes staphylococcus found in the mouth. When we get into the digestive system though, then we start to find a lot of gram-negative microbes. Okay, these are just generalities. Of course, you're going to find gram-positives in both environments and gram-negatives in both environments. Of course, you recognize the benefit that the normal microbiota provide to us. And how they can also sometimes serve as opportunistic infectors. One of the things that you might want to do is put together a chart that allows you to compare Streptococcus pyogenes with Staphylococcus aureus. Compare their virulence factors. You'll see that there's a lot of similarities there. Compare the diseases that they cause. Slightly different, but in some cases there's some overlap, which just brings up a point as an aside, and Jerry sent me an email with regards to this. There is a condition, and I forget where it is, but it's a woman has contracted necrotizing fasciitis, but the microbe that's causing it is a different microbe. It's Aeromonas hydrophilus instead of what we learned, Streptococcus pyogenes. That's not uncommon, though, that you'll find that there are a number of microbes that can cause similar diseases or similar conditions. And in this case, especially if it's one that's being produced by a toxin, and necrotizing fasciitis is a toxin-induced condition, if that is being carried on a plasmid, you could see how that could get transferred to another microbe that might be able to grow in it. I'm not saying that's what happened here with Aeromonas. But there is this case where this woman's already lost 1 foot. They're taking off both her hands, her whole leg, and thigh.
Really quick, too.
In days.
Yeah. Went back the next day with the pain, and they gave her pain pills instead of following up, and they amputated her leg like 2 days after that.
Yeah. Serious condition here. Don't want to bring anyone down. I'm just saying that there can be conditions, and I bring this up because we talk about pyrogenesis and Staphylococcus aureus. There can be conditions where different microbes still cause the same condition. And we mentioned pyroderma or impetigo as an example of this. This is a skin condition that can be caused by both of these microbes here. So in talking about the upper respiratory system, we mentioned viruses that infect the upper respiratory system. Mainly the common cold is what we talked about. And then keeping in mind, because we're talking about viruses here, if we move into the lower respiratory system, then we have influenza. Okay? And the reason I bring this up is influenza, the viruses that cause influenza, can undergo antigenic drift and antigenic shift. We talked about this early in the semester, okay? But it is also broached in this section here as well. So you'll want to be sure that you're familiar with antigenic drift, antigenic shift, how it relates to the flu virus, and that the flu virus now is infecting something lower in the respiratory system. Keep that clear here. The cold virus infects the upper respiratory system. You get lots of those, minimal symptoms, if you will, or mild, I should say. The flu is going to be a more severe condition, lower respiratory system. A lot of times you develop the flu when you become immunocompromised. You see this all the time where people will go into the hospital for one condition and develop pneumonia because of the fact that they're immunocompromised, and a number of those microbes, Streptococcus pneumonia, Klebsiella pneumonia, are part of our normal microbiota. And so it's already inhabiting us, and it's just waiting for the opportunity to cause illness. Oh, and see, I'm confusing myself here. You guys didn't catch that? You should have caught that. I was talking about a virus, and then I mentioned some bacteria. Don't let me do that. Don't. Stop me. It's been a long day. You can't let me do that, because then that's going to confuse you. It's on tape now. Someone's going to put that. Anyway.
Everybody's beginning to say, erase the tape.
Yeah, okay, so let me reverse what I'm talking about here. I'm comparing cold virus, flu virus. The flu virus is going to infect the lungs. And I talked about pneumonia coming or developing because of a sickness or an illness, it being an opportunistic infector. The microbes that I mentioned, Streptococcus pneumonia, Klebsiella pneumonia, those microbes are there inhabiting your body, and they can cause pneumonia when you get the flu, because the flu can cause your immune system to become depressed, and now those microbes are already there, and so the microbes take advantage. So that's what I was trying to say. I didn't mean to cross virus versus bacteria. That's not good. The other thing to keep in mind with regards to these diseases that we're talking about, transmission. How are they transmitted? Remember we talked about this in the epidemiology chapter, it has to leave the reservoir, and infection has to be by appropriate method. Okay, so keep that in mind when we're talking about transmission. Bordetella pertussis, microbe that causes whooping cough. So another study method that you might want to employ is to tie the microbe to the disease, because of course I'm going to ask you that. Okay? I'm going to ask you, which microbe causes this disease. Okay? Again, and then also tie that microbe to the system and the condition that it causes. Okay?
When you say condition, you mean disease, correct? Whooping cough would be the condition.
And sometimes, yeah, but sometimes the disease is identified by a very specific condition. In that case, you need to know what that condition is. For instance, Lyme disease. For instance, Lyme disease is, a rash, a concentric
So the
ring.
condition would be the bullseye rash?
Yes.
Okay, when you say condition, you're looking at a symptom.
Sure, yes. And usually it's going to be, you don't have to, and that's what's great about this test. I'm not asking you really to come up with any information. It's all there in front of you. You just have to mash the stuff together. Tuberculosis, Mycobacterium tuberculosis infects the lungs. Here's another example of this. What if I said something about the formation of granulomas? Okay, that's a condition that would be indicative of tuberculosis. Now, I'm not going to really, I'm thinking back to the test here. I don't think I ask you really any questions about whether or not we have vaccines for a particular disease, or we don't have vaccines, or if there are antimicrobials for a particular disease. I might ask you about vaccination, back to the chapter that dealt with that. But I won't ask you if we have a vaccine for diphtheria, or if we have, so you don't have to waste your time on studying whether or not we have vaccines, or studying whether or not we have antibiotics for these diseases. That's just FYI information that we threw out when we were having a discussion, but I won't ask you questions on that stuff, okay?
So you've been asked which type of antibiotic?
I won't ask you which type of antibiotic would you use to treat, tuberculosis or something like that. I won't do that. Okay. That's a little too specific for us at this stage. At some point in your career, you probably have to know that, but not now. Speaking of influenza, we were just talking about it. Recognize there are three types of it.
The A, B, and C.
A, B, and C, yeah. Don't confuse that with the hepatitis A, B, and C. So, moving on to the skin then, recognize the microbes that are part of your normal flora, the diphtheria strains, the staphylococci strains, and the yeasts. Of the diphtheria strains, we talked about Propionibacterium specifically, Propionibacterium acne. So you should know a little bit about that condition. Also, we talked about folliculitis, Staphylococcus aureus causing this condition, so you should be familiar with folliculitis. And the two other conditions, furuncles and carbuncles, that develop from folliculitis expanding into neighboring tissues.
So with the Propionibacterium acne, that does not cause acne, correct?
It is not the cause of acne, no, but it is present.
It is present,
yes.
But it doesn't cause the acne. not the cause of that.
Right. Now, generally, the cause is the fact that you've got your pores are being plugged, and so the sebum is not being released, and it builds up, and that's a food source for the microbes. So the microbes then grow, and then you've got an extended population that releases bacterial products. You've got neutrophils and macrophages then that attack those bacteria. The other thing I won't ask you about specifically, I guess, would be the anatomy. You know, I won't ask you about the anatomy of the digestive system, where you have to know the mouth, the esophagus, and the stomach. But you do have to know what's going on in those things. So, I mean, you kind of have to know the anatomy anyway, but I won't ask you specific questions about it, unless it's in reference to a microbe. For instance, you know, if we're talking about the skin, of course, I might ask you why Staphylococcus prefers to grow on the skin. You know, what is it about the skin that's beneficial or allows for it to grow there? You know, no, I won't say that.